introduce our debaters. We have Nick Dixit. And we have Robbie Bruins. Andrew Glidden. And Caitlin Sills.
First, I'd like to say that our position is not one in support of the status quo. We agree that there are serious reforms that need to be made to our healthcare system. And we also agree that our healthcare system should be made more accessible and more affordable for the average American. But the bill that's currently before Congress will not produce those solutions, and in fact, it makes the situation worse. But this debate is not about pointing out the short-sightedness, philosophic failings, and economic illiteracy of our opponents. It is about finding a solution.
We support reform because it would protect patients. It would ban discrimination based on pre-existing conditions, which are often genetic or beyond our control. It would prevent insurance companies from dropping us when we get sick, just so they can make a buck. And we support reform because it has good ideas, like a public option, which would both lower costs and promote competition. When the police save your life, they don't look at the size of your bank account. When the firefighters come to your house, they don't ask for your credit card. This is about the values, like equality, which have guided our nation for centuries. To quote the late Ted Kennedy, "What we face is above all a moral issue. At stake are not just the details of policy, but fundamental principles of social justice and the character of our country."
What is the single most important reason to support or oppose the Obama health care reform?
The reason to support healthcare reform is that we have an obligation to take care of our fellow citizens in this country. We recognize that obligation when we have universal public education, we have a promise of a decent retirement through Social Security, we have protection from fire and disasters. These are well-established principles in our country, and we need to extend it to healthcare because no one should be dying because we have a dysfunctional system that's based on profit rather than patients.
Okay, I think the reason not to support the Democrats' bill essentially comes down to two things. First is technical. The plan will not work. It doesn't fix any of the things that make healthcare as costly and unaffordable as it is, and makes many of them even worse. The bill is projected to increase insurance costs by over 75%. It does not have an effective price mechanism because they can cover any shortfalls of taxpayer money or just run the printing presses and pay for it by devaluing the dollar through inflation.
I'm curious to know more about the impact of the proposed reform on two particular issues. First, quality of health care. Second, innovation in medicine.
So a discussion of medical innovation is sort of a separate issue. I think we could do it a lot more efficiently, but it's not really going to change with this specific reform bill too much.
All right, well, first we'd like to point out that a fundamental point, that health insurance does not equal health care. You can have health insurance and not get the care that you need. You can have health care and not necessarily have health insurance. We don't have health insurance so that everything that we could possibly buy that has to do with health care is covered. That's not insurance. Insurance is when you have something catastrophic that you didn't predict and you want something to cover that. So we don't want health insurance to be so comprehensive as to cover things that we could pay for ourselves.
As for this distinction between health insurance and health care, I can tell you one thing. If you don't have health insurance, you're probably not getting health care. And as for quality, we improve the quality of health insurance. First of all, we make sure 46 million people have it. That's an improvement from zero. And second of all, we prevent insurance companies from doing these abusive, dubious practices, like dropping people after they get sick, like discriminating based on pre-existing conditions, like canceling or rescinding coverage.
Who, in your opinion, stands to gain or lose most from the outcome of this debate?
So imagine if every American was required to buy hamburgers. Imagine how much McDonald's or any other hamburger company would benefit from that rule. That's what we're doing for insurance companies. It's a massive bailout. The individual mandate, as combined with community pricing, actually increases premiums. That would be the monthly payments that we pay to insurance companies for coverage on the young, and it also increases costs for small businesses.
Listen to us. Do we sound like insurance company shills? We're not interested in protecting the profits of any industry. We're interested in helping the American people. And this notion that we don't need health insurance, so you can choose not to have it, that's heinous. Everybody thinks, I don't need this, until they're the one who goes into the ER, and then they can't afford it, and then everyone else has to pick up their tab. And as for who gains, everyone gains. The people without insurance who are dying gain. The people who have insurance and are seeing their costs rise 4 times faster than wages gain. The only loser I can really think of is the insurance companies.
Where is the cash for this reform going to come from?
First and foremost, we end corporate welfare. Now, we also tax the wealthiest 0.3% of Americans, the millionaires of America. This isn't a middle-class tax, this isn't an average tax, and these are the same people who got huge breaks under the Bush administration and quite frankly can afford it.
As far as they can afford it, what we are arguing for is not what people can afford or not afford. We are arguing for the moral right of people to have their own property. This bill does not reduce costs, it only shifts them. Having the rich pay for it is an injustice that does not provide any cost reduction and will in fact cause the so-called rich to disinvest, hurting the economy even more.
Should access to health, by whatever means, government run or otherwise, be considered a right?
We do think healthcare is a right, and we think any society that has the wealth to assure healthcare to all has the moral obligation to do so. And we already do this. We do these moral obligations all the time with Social Security, with police protection. It's not some new thing. We're just trying to extend it to healthcare.
We would agree that access to healthcare is a right because we define rights as the freedom to have something. It's not the guarantee that you're going to be able to get that. And that's really what the difference is in our opinion or our definition of a right.
But when people call healthcare a right in the sense that they are entitled to care provided by others, they are sacrificing others' right to their lives, their wealth, their time, and their effort.
And secondly, there are many things that you don't have if you don't have the money to get it. You may not be able to have food, you won't have clothes, but do we have a right to food or clothes, and why not?
This isn't some radical notion. The right to life is one of in fact, the first inalienable right in our Declaration of Independence. And it's just so basic. If you should not be dying in the street, that is morally repugnant, and I don't think that needs explanation. The Republican Party agrees that there is a right to life. They just think it stops at birth. We think that right to life should extend.
I was going to talk about how we pay double for healthcare in this country compared to what they pay in every other industrialized nation, and yet actually get worse results and all of that. But I ran into a friend of mine from high school earlier this evening, and he reminded me of why I'm here tonight. My friend's name is Elliot, and he now goes to SF State University. I asked what he was up to, and he told me that he'd recently been in a really bad car accident. And then he told me that shortly after he had his surgery, his health insurance company, Aetna, informed him that he was no longer a policyholder as of just 3 weeks before his accident. They said that they lost his paperwork, that they had no records showing he was still insured. I wonder what insurance companies think their job is if it's not looking after records and paperwork. We can do better than that in America. We're going to do better than that this year because we will decide as one country that we have the compassion to provide healthcare unconditionally to all.
I'd like to point out that this is not an issue of reform versus no reform. This is an issue of whether Pelosi's bill is better than the reforms that we've proposed. If you look at the reforms that we've proposed, which have been transparent billing, the lifting of interstate restrictions on insurance companies, you can definitely see that these reforms will lower costs and in doing so increase coverage. Unlike Pelosi's bill, which increases coverage by forcing everyone to have insurance that has been decided by the government.
I'd like to add that what you're fighting for in the government plan is not your friend's right to health care, it's your friend's right to hold the rich at gunpoint for his health care. I think you should be ashamed of that.